the situation, and I think we are getting a taste for it. So I think we are going to do it all the time now. So get used to it.
Get used to it. Okay, I will.
At least the leaders of the parties at the national level is very, very important. So we were talking with Anami this morning, and I was not aware, but I gathered that each one of the Liberal, the NDP, and the Green Party have moved similar resolutions in their caucus related to national standards for long-term care. If you can comment a bit on the issue of national standards and tell us how we can work together. You know, the situation in the country is horrible. In Ontario, yes, is even more horrible. I think if before Quebec was the first and we were the second, we may be the first now, I don't know, but it's pathetic. Yeah. And if we do not succeed to move both here in Ontario, and we can tell you more after, the issue of the 4 hours and specific skill mix, we never will be able to if we don't do it now. And by the same token, the promise of the Prime Minister, if it doesn't move to reality with national standards, we're never going to see it. So if you can comment how we can work together in a multi-partisan way, -1 probably at least, or -2, I don't know. But bottom line, to push it so it happens before.
Yeah, I think you can only count on one. I mean, we're the only ones. I asked the question again about it yesterday. I've been pushing for it, and there seems to be no desire on the Liberals' part to move on it. They just keep on talking about it, but no desire to move on it. So we are adamant it should happen immediately. We need national standards. We need to get rid of profit out of long-term care. They can start with Rivera. It's owned by a federal agency. We can start there, and we can use the Canada Health Act to roll in long-term care and move towards funding only not-for-profit and funding public or not-for-profit. And that way we can starve the for-profit out of existence. But we're very clear. We want get rid of for-profit, and we want national standards.
So when you say, I understand the not-for-profit, but when you say national standards, can we specifically speak about the hours of care and the skill mix? Because that's the piece that we want to also push together.
Yeah, absolutely. So all the experts are saying there's got to be a skill mix that's got to specifically include registered nurses. It's got to include nursing. It's got to be very specific around hours of care. The hours of care that we're hearing at a minimum is 4 hours. And so, you know, all the experts, really, frankly speaking, all the standards are already out there. It's just a matter of putting it down. This is all the learnings. We've even seen that you can have, and you know this better than me, Joyce, but you can have even outdated facilities, and we saw examples of this in Ontario, but when the level of care is high enough and the hours of care are high enough, even if the facilities are outdated, even if the facilities are crowded, but if you've got nurses and if you've got personal support workers with enough hours of care, you see great outcomes, even in the older buildings. So it's paramount. We've got the evidence. You all have shown it to us again and again. When nurses are able to do their work and are paid enough and are given enough hours, the outcomes are great. And the evidence is all really unequivocal about that.
Can Andrea then, or you, or whoever in your team send us specifically where you have the hours of care delineated and the because I think if we succeed to gather that from whoever parties that have it, I think it will be very powerful to convince the federal government to actually move with meaningful standards. 4 hours in itself doesn't do it enough, right? So if you have this specific,
yeah, specifically on the hours of care and the mix of care.
And is the skill mix, we will follow. I will follow up with your office on that specifically.
Yes, perfect.
Thank you.
What is the hours of care that you're looking for?
So we will send it to you. It came in the, so we will send you the letter. I think we sent you this morning, but it was short notice again, so I apologize.
No problem.
What we are asking, basically the commissioner adopted completely what we recommended. So it is 20% RN, 25% RPN, 55% PSW in the 4 worked hours. And that equates to 48 minutes a day, 48 minutes in 24 hours of an RN. So it's not a lot. 60 minutes of an RPN and and 132 minutes of a PSW. And we are asking, in addition to those 4 hours, one nurse practitioner per 120 residents. And we are also asking for one RN. Well, actually, we said one nurse, but the commissioner stated one RN for IPAC, infection prevention and control. So we actually will send you what the commissioner recommended because it's very powerful. And
Sounds
I
good.
think
That
it
sounds
helps
great.
given that the commissioner said it. Yes, you can mention RNAO, but the commission said it is even more powerful, right?
Right. That's a really good point. That's a very good point. Excellent.
The other thing that we are two things if we have time to discuss. One is the opioid crisis. The other is the issue of vaccine justice. And if you can tell us what you are doing with the piece on vaccine justice, we have an action alert. We can send it to you. If you can push it amongst your constituency, the issue of until the poorest of the poor of healthcare workers in other countries and they're people are not vaccinated, we haven't done good enough. And the issue of removing the patent, right? Waiving.
Yes, waiver. Yes, we've taken a strong position on that.
I know.
I asked the question a couple of days ago as well, saying that the U.S. is already committed to waiving the patent. Why won't the Liberal government make the same commitment? And they kind of came back with a really weird answer saying we commit to the negotiation or commit to having a conversation. But it's like, why not? Like, the U.S. has already done it. They've already said they're going to commit to the waiver. Why is Canada so afraid to stand up for people? So very confusing. We should be waiving
Matt just put the commission report link, and Matt, maybe you can put the action alert on the vaccine justice. The reality is, Jagmeet, I honestly do not think it will happen unless there is a lot of pressure. Hence why if you can use this action alert and add whatever, you can add the letter that you had said, you can add the questions in the, in the house and send it to all your people. The more we can push together, as many groups as possible and parties as possible, maybe we have a chance, maybe. Otherwise, I don't think we have any chance. And I think it not only will affect the poorest of the poor, that for sure, while their lives are as important as ours, it will also affect public health internationally, no doubt.
Yeah, no, so true. Because we've seen, like, if there's an outbreak anywhere in the world, we are in a global society, it's going to impact us again. So we've got to tackle this globally, right?
Yeah. On the opioids crisis, we know that you are on the same page as we are, but what can we do together is more of a question.
That's a good question. What are you thinking? Because this is something that's been so long-standing. Where can we push? Like, what is a good angle you think that we can push on this one?
Well, first of all, the situation is much worse than what it was, right? It's absolutely much worse than what it was. And second of all, Matt, why don't you share the three-pronged approach that we are taking?
Hey, Jagmeet, how are you?
Hey there, Matt.
Yeah, the two places that we would push the hardest and are trying to push the hardest are safer supply.
That's Matt Calloway. Wow, sorry. You look great with the beard, brother. I didn't notice the beard. That's great.
Yeah, so sorry. I'm trying to follow your example, Jagmeet.
Looks great.
Thank you. Yeah, safe supply. So the federal government's doing some funding of safe supply, but it's really still in the form of a lot of pilot programs and research and funding for safe supply needs to be expanded right across the country. I think that's issue number one. The other push that we have on is decriminalization, and you're seeing.
Sorry, I lost you there for a second. There, it was on my end. I had a audio glitch. Yeah, you said focus on safe supply.
Yeah, expansion of safe supply programs and funding across the country. And really the second big push is on decriminalization. You're seeing motions coming out of Vancouver and Montreal. For years, the Toronto Public Health board has been pushing decriminalization. We're hoping that the City of Toronto Council will put forward a motion. It'll need some more push, but the big cities across the country are pushing decriminalization, and it would be great to see that push in the House as well.
And the third is to have many more sites where people can inject safely and with the supervision that they need, which we are still pushing here in Ontario, but this is across the country. It's across the country, right?
Yeah.
And we have kind of a link and not link action alert on the issue of assisted devices. I don't know if this is a national issue, but certainly it's in Ontario, where mental health is not part of it for assisted devices. So for example, we have a colleague, Cheryl Forchak, that works with people with mental health illnesses, and there are a good portion of them that also have substance use. And she uses handheld devices and all kinds of things that the research shows is fantastic, but she cannot move it into action because people cannot get the funding for a handheld device as a assisted device. So it's a kind of a bit link. Also housing is a bit link. But overall, where can we connect the dots between you guys and us?
Well, I think the decriminalization is, I've called for that for a long time. I think everyone's there. That's the easy one. I think the next big fight is the safe supply. That's where people are a bit nervous. I think the evidence is, again, come overwhelmingly clear. If you want to save lives, that's the way to save lives. So the safe injection, I think people are also, there's always a little bit of NIMBYism where people are like, don't want it in their backyard, but people get that works. And the decrim, I think, has become more and more accepted that, people who are dealing with addiction, people who are dealing with poverty, and people who are dealing with mental health issues, they're not going to benefit from a criminal justice response. We need a healthcare response. So that argument, I think, is finally penetrated enough into people's minds that it's there. And so federally, we'll keep on pushing for it. But I think the next big fight is really the safe supply. That's the one where people aren't there yet. They don't, it just sounds scary, I think, if people are just nervous about it, but it is, the evidence is clear. Like that is how we save people. That's how we save lives. So we've got to do it.
Angela, I think Angela wanted to comment. I saw her.
I wanted to add about the National Pharmacare Program. And I know before the budget came out, the federal budget came out, the Prime Minister was supportive of that. Now when that new budget came out, that disappeared, went on the back burner. How could we work together for a National Pharmacare Program?
Well, it's a great issue. And you know what? I'm just actually going to sign on now with my other device that'll help me. There it is.
Now we can see you. You're mute.
I'm mute.
Yep. All right. That should be better microphone as well, hopefully. Okay, good. So what we need to do is we put forward a bill, and the bill that we put forward was basically exactly what the report that the government commissioned. So the government commissioned this report. I'm sure you all read it, the Dr. Hoskins report, and it recommended that one of the steps to move forward with National Universal Pharmacare is we need a Canada Pharmacare Act, just like the Canada Healthcare Act. To make pharmacare actually happen, we need a piece of legislation, Canada Pharmacare Act, that would help us move forward. So we put that forward in legislation thinking, okay, we don't know why the Liberals are delaying, but they are. Let's move forward with some legislation and show them that it can be done. We put it forward, presented it in the House, debated it, and then the Liberals voted against it. And it's confusing because it wasn't actually voting against our idea. Sure, we would be upset, but it's actually their own report. Like they commissioned the report that says in the report, this is one of the key steps. And we literally took that from the report thinking, let's make this as non-controversial as possible. Just use the government's own report and try to push forward universal pharmacare with what they commissioned. So why would they have an issue with it? But they voted against it. And at that point, it really dawned on me, maybe they have no interest in doing this, because it was really like, it was very confusing, because it was their wording. It was the wording from their own report that they're not accepting. So I'm at a loss. I don't think that they didn't mean it. They campaigned on it. They said it in the throne speech, but now they've abandoned it. And more than abandoning it, they voted against it, which is, I don't know. I can only think of one real solution. If we really want pharmacare, you've got to trust New Democrats to deliver it. That's my only real concrete solution. So if we get more of us elected, we'll make it happen. But otherwise, I don't see the Liberals doing it. I don't know why, but same with the patent waiver and same with the pharmacare. They just keep on siding with big pharma over people. And so that's what we're left with.
Well, national health care came from the New Democrats.
Yeah. There you go.
It's the same issue with the waiving the patent, though, for the vaccine.
Yeah, exactly. Good point. That's exactly it. It's the same. The waiving the other one too. There's we found 3 issues, and then we started. That's a real pattern. There was the committee that sets the medication prices. They requested a change in the list of countries, and in 2015, the Liberals promised to do that. They just wanted a new list of countries. They needed legislation to do that, and they can lower the drug prices in Canada by about 20% if they had a better list of countries to set the prices. They didn't do that. They haven't waived the patent waiver, which poor countries have asked for, and they voted against pharmacare. So that's 3 now, pretty clear pattern of behavior. So it seems like they just want to support big pharma and not really the people. So that's what we're dealing with, and we're going to keep on fighting, and we're never going to give up. But it's becoming clearer and clearer to me that they just don't have an interest in it.
Yeah. What are the issues that you are interested in partnering on?
The 2 ones that we've been pushing recently, I would love to hear your thoughts on it. We were looking at that 1960 commission, which talked about the first idea around having healthcare. And initially in the report, they envisioned medication coverage, which we've talked about, pharmacare, but they also envisioned dental care. And at the time, the report said something really interesting. It said there weren't enough dentists at the time in the 60s in Canada. So they said it was impractical to add it now, but it was envisioned. Like the idea of healthcare in Canada was supposed to include dental care. So that's another big one that we're pushing for. We're finding lots of people need it. Yeah.
We have it. We always had. Teeth are part of our body as far as we know.
Yeah, exactly. So that's the next one I think we can team up on, is on dental care, and then mental health supports.
Yes.
The COVID has really exposed that more and more, and people feeling isolated, feeling alone, feeling the mental health stresses. So access to mental health services, that's something that we want to also include. So we have a really head to toe healthcare, covers your whole body, doesn't cut out the teeth, like that head to toe idea.
I know one of our colleagues that is attending, Sue Faber. She deals with Lyme's if you want, Sue, just for a very short couple of minutes, if you want to share and see if you have a partner here for your cause. We have members with all kinds of causes.
That's great.
They bring resolutions. Sue is one of them that brought a resolution years ago. And really, we have helped her a lot to move successfully on many fronts. But I think she will much more eloquently tell you what she's up to now.
Okay.
Thank you. Nice to meet you, Jagmeet. So my area of focus is Lyme disease in Canada. And I did a lot of work along with colleagues, meeting with federal representatives back in 2017 and 18. And I also participated in a HESA meeting on Lyme disease as a witness. The area that I'm most concerned about, there's many areas and issues within the Lyme portfolio, but is the issue of transmission of the organism from a mother to her baby.
Okay.
In pregnancy. And this is an issue which has received very little help or attention within Canada. Mm-hmm. And I've worked with the Public Health Agency of Canada for years, talking to them about this, meeting with their executives, trying to move this issue forward so that families can get help.
Right.
And the one issue that I've requested for multiple times is a multidisciplinary task force to bring together physicians, nurses, patients, scientists, epidemiologists to address this issue. Mm-hmm. So that, because right now in Canada, across Canada, there are children who are unable to access care because they're told there's no evidence that Lyme can be transmitted from a mother to her baby, even though there is. So, and just one other point I wanted to share with you is, much to our significant concern, we discovered that 3 federal websites historically acknowledged adverse pregnancy outcomes and maternal fetal transmission. And all 3 websites, that information was removed.
Interesting.
Yeah.
Why would it be removed?
I asked the Public Health Agency of Canada. They told me that they would look into it, that they would give me that information, and I never heard back. And so a clear risk to pregnant women has been removed, or was removed, from these 3 separate Health Canada, Public Health Agency of Canada, and Occupational Health and Safety Canada. So it's a significant problem. And I'm wondering if, I've met with John Davies, I met with several others back in time, but I'm wondering if we can re-engage with your party on this issue as well.
Yeah, that sounds like I mean, it's really interesting that it was there before and it's no longer there now. And I didn't know about, I mean, I knew of Lyme disease, but I didn't know about a particular risk of transmission from mother to baby. So that's really, for me, something I didn't know about. So it's good to learn about it. And also how we can partner on that. I think the work with Dawn as our health critic is great. And now that we've got this concern from you, we'll take it back to our team and see if there's anything we can do to support.
Thank you.
And I'm sure other colleagues have questions. I will let them in, and then Morgan will say thank you, just to be mindful of your time. But before she says thank you and my colleagues ask other questions, I just posted something to retweet about the meeting with you now. And I'm going to post another one because I'm going to ask you a question, and then we can tweet that you said the same. So Anami just said, doesn't matter which party, but nurses need to run. We need nurses to run for all the parties. So that's her tweet. Go retweet. Tweet about Jagmeet, tweet about her with all parties. And if you want to say the same, I'm going to take a movie of you, like I did a movie of her.
Yes, yes. We want nurses to get involved for sure. Okay, let me know. Ready? Let me know when you're going to go.
Fast. Okay, Jagmeet, you go.
Yes, nurses, wherever you are in this country, please get involved in politics and run for office. Obviously, I'd prefer you run for New Democrats, but run at any level for any party. The more nurses that are in our political system, the better, because you understand healthcare from the ground level. It would be amazing to have you represent.
Bravo, nurses, run, run, run. So I know some other colleagues. Suyan, why don't you share a bit, Suyan? First of all, good to see you again. And I'm sorry about your mom's loss.
Thank you so much. Thank you so much. And Mr. Singh, I want to thank you for you to come to visit us. It's, I'm going to get emotional a little bit because I just lost my mother in the nursing home.
Oh, I'm so sorry.
And I'm very grateful for all the nurses that help us. I'm a nurse myself. I completely understand the work that they are doing, the hardship, but from the patient's point of view, I experienced tremendous, tremendous comfort in their caring, in their professionalism, and in just the human touch in this terrible COVID world. My mother, who's been suffering, we went to see her. We were in gloves and all covered. She couldn't speak the language. She couldn't express her needs or wants or her loneliness and isolation. So I'm convinced that she died of loneliness. I want you, from your position, to really speak on behalf of Canadians, especially from the diverse communities, that we really need the voice, especially in this healthcare system. Nurses make a difference, and we need more of us in the front line, and especially our vulnerable families. So I just want to tell you from my personal experience that is I am thoroughly touched by nursing as a patient and as a family, and also as a nurse. I work in public health, and I work day and night, I'm not kidding you, in this contact tracing, immunization, policy decisions. Things just change within minutes, things change. But how are we expected to respond to these change if things just change and operationally it's just impossible to keep up? So I asked for stability from the nursing point of view. I asked for empathy, sympathy for our vulnerable. I asked for your support for nursing. And this is our nursing week. We continue to be strong, to be proud, to be standing. And I'm not kidding you. When I heard of my mother's passing, I literally just fell, because she has been a rock for our family, and her descendant is all over the world. It just heartbreaking. But I know you understand, and I just want to plead for your help. Thank you so much.
Thank you so much, Suyan. Thank you for sharing your personal story. It's so tough, and you speak for so many people that lost loved ones in long-term care. And we saw that report out of the military, that additional new shocking revelation that many people lost their lives before the military arrived, not because of COVID-19, but because of neglect. Many people were dehydrated and malnourished. So there's some serious problems that we've got to fix.
Yeah. But in my mother's case, the nursing home is just exceptional.
No, you're absolutely right.
But I want to just acknowledge the tremendous support that the nurses had, the other professionals. But we're asking for, from the nursing's point of view, we're asking for some basic care, 4 hours a day. That's not too much to ask. We're gonna get one day. It's a selfish plead.
Yeah.
So I hopefully by the time I get there, I would have at least 3 hours, maybe. I don't know.
No, we've got to fight for as much as we can, for sure.
I hope by the time, long before you're there, Soyan, we are at 4 hours a day. So
Morgan, well said, Morgan.
I am the director of care at a long-term care home in London, and would say the pandemic has definitely highlighted very long-standing issues in long-term care, which is not the fault of the staff members who work in long-term care. It's not because they don't care. It's not because they don't want to take care of residents. It's because they're not resourced in a way that they can provide the quality of care that residents in long-term care deserve. So I would say national standards for long-term care need to include the staffing ratios that were recommended in the most recent commissioner's report, that were recommended during the basic care guarantee, because it really will make a difference for residents and will help to improve their quality of life, their experience, but also their well-being and their health as individuals.
Absolutely. Thanks so much for that, Morgan. I really appreciate that. And it's so important to note that throughout this, it's not the personal support workers, it's not the nurses, it's not the staff, it's the system that they're dealing with, the lack of hours, the lack of resources, as you stated. Absolutely.
Yeah, I also would say, as someone who works in long-term care, that national standards needs to also think about and consider in different provinces. We have different long-term care homes acts that we're required to be compliant with. Compliance doesn't necessarily equal quality. So what we don't want is another list of things we must do to be compliant. We want things that will actually improve resident outcomes.
So good. So true. With that, my friends, I have an interview That's right at 5 o'clock. So I'm just a couple of minutes late for it, but I can probably jump on. It's a Zoom interview as well, so I should be okay.
Okay.
But,
well, thank you so much for taking the time to meet with us today. I am very glad that we have expanded our Take Your MPP to Work campaign to include our MPs as well as our party leaders. So thank you so much. There's a lot of federal health issues that I think we can work together to create solutions for. So we look forward to continued partnership with you and the rest of the MPs that you work with. So thank you so much for taking time to be with us during Nursing Week. Thank you so much. Happy Nursing Week. Thank you all.
Before you head out, I'll just take a quick photo of everyone too, if you're all right with that. You can leave on your camera.
Go ahead and do it.
And we'll send it to you as well. Okay, I'm gonna count down on 1,
Do we
2,
want to do the thumbs up for nurses?
Sure, yeah, that looks good. Okay, 1, 2, 3. Great, we've got it.
Thanks all. Take care. Bye.
Thank you
so much.
Suyan, thanks for sharing, Suyan.